Okay, Dr. Demark-Wahnefried, we are live.
Great, thank
I
you.
want to thank you for joining our Tea Talks today. I'm actually super excited about what you have to share, as I think our audience will be. I would like to first kind of set the stage. Today, we are going to be talking about a really incredible resource, cancer wellness resource, that is in the form of a study. But I had a chance to navigate around the website that you'll be sharing with us, and I find it to be amazing. In fact, when I got to the end and it went through the inclusion exclusion criteria, I'm not over 50, I'm not in survivorship, so many things. And I was like, could I write to you and ask for an exclusion so that I can join? Because what a great resource you're providing. But I'd like you to maybe take a couple minutes to introduce yourself to our audience, and then we can dive deep into the incredible work you're doing.
Okay, well, thank you. It's great to be here. My name is Wendy Demark-Wahnefried. I am a professor at the University of Alabama at Birmingham, and I also am an associate director for the O'Neill Comprehensive Cancer Center in Birmingham. And I have been doing nutrition and exercise research in cancer survivors for, geez, almost 30 years now. And thank you for the kind words about Amplify. It's our latest kid on the block, if you will. And what I wanted to do today is just kind of go over the guidelines for cancer survivors as far as diet and exercise. Just really briefly review and then talk a little bit about the Amplify program because I agree, I think it's a great resource.
It
So,
is a fabulous resource. Doc, before we dive into the guidelines, talk to us a little bit about how your career was shaped into this particular area, and then how you got into thinking about developing studies like this that quantified the effect of wellness in the cancer journey.
okay. So I got my degree at Syracuse University, and I first was into cardiovascular research. And then I had the opportunity to work with a fantastic investigator, Barbara Reimer, and I was hired at Duke. And one of the very first studies that I did was to track. She basically said, "Well, you know, Wendy, there's one of the big problems that breast cancer patients have is that they tend to gain a lot of weight while they're on therapy. And you're a nutrition scientist, you should be able to solve this problem." So I, as a very early career scientist, I got an award that allowed me to track 53 women with breast cancer over the course of the year. And we did diet recall. We found out what they were eating. We found out how much they were exercising. We measured their metabolic rate and their body composition. And what we found in those women is that they weren't eating anymore, even though they were gaining a lot of weight, they were gaining a lot of fat mass. But they were exercising less, and the
Mhm.
body composition changes that occurred in them over the course of just 1 year period were equivalent to 10 years of normal aging, which
Wow.
was, it was incredible. It really was incredible. And the answer to that is yes, diet is important, but exercise and strength training even more so. So
Wow.
then what we started to do was to do interventions in that population, in breast cancer, and women with breast cancer, as well as other cancer populations, to see if the diet and exercise program could make a difference. And so that's where we are. And we found that we could make a difference. But then how can we get that program pushed out so that more and more people could take advantage of it? So that's kind of where we are. We started off with just kind of telephone counseling and mailed materials, and now we're entering the space age with a website program.
Well, it's really amazing. And I think when you're going through life and you encounter a diagnosis that's life changing, so many things pop up on your radar and you kind of go into survival mode. You're really thinking like, how do I prioritize the decisions that I'm making in my life? And I think so many times, so many of us put wellness, food, movement, stress reduction, all of those things almost at the bottom of the list in favor of these other things. And it's really amazing what we're going to learn from you today is that it's as important, maybe even holistically more important, to have a healthy body that's able to, metabolize everything from treatment to experiences differently. So I'm actually really excited. Okay, so I'm going to test my skills. I'm not the head presenter here, so hopefully my partner Sharon is proud of me. But I'm going to test my skills because we're going to share the screen, and you can go through the guidelines for diet and physical activity. So take it away, Doc.
Okay, so these are the guidelines. There's two organizations that make guidelines for cancer survivors. One's the World Cancer Research Fund, American Institute for Cancer Research, and then the other one's the American Cancer Society. And if you look at these guidelines, they're remarkably similar. So right at the top there, achieve and be a healthy weight, achieve and maintain a healthy weight. Why is that at the top? Well, the reason that's at the top, that's where we have our best data. And the data show that that individuals that come to the cancer diagnosis, overweight or having obesity, tend to have worse prognoses, not only for cancer, but then for cardiovascular disease. And so we care about that. And we also know, again, individuals that are treated for cancer tend to gain weight during their therapy. So we need interventions that will help that weight management so that we can really get people so that they survive longer and are healthier longer. Next thing is to eat a diet that's rich in vegetables, fruits, and whole grains, and to limit red meat, processed meat, and then sugar. Now, that always opens the question, does sugar cause cancer? Not that we know of, but sugar is really important for weight management. And so you have to keep that low to keep the weight in check. And so that's primarily why it's important. Limit alcohol. We know that alcohol is a carcinogen, and now we know stronger data that alcohol really isn't that protective for heart disease. For years, we used to think, oh, a few drinks a day is good for your heart. Now we know that's not necessarily the case. And then to be physically active, at least 150 minutes a week. So that's roughly 30 minutes a day of physical activity. So again, we've been really working on, these are guidelines, and in the back of all of our brains, we know that that these make a lot of sense. However, easier said than done, right?
Yeah.
And so how, in the back of our brain, we all know what to do, but how do we do it? And so our mission is really to support cancer survivors to undertake those goals. And I want to talk about a program that's called Amplify. And I don't know if you can pull up that slide, but I see a message here. Am I supposed
Yes,
to?
I wanted to take a pause to ask a question because one of our audience has a question. Are you using any strategies to get this study message out to at-risk populations such as Black women who are at higher risk of dying from breast cancer?
And I am so happy that this question came up because, again, yes, there are huge racial disparities in cancer, and so the one of our aims for Amplify is to over recruit individuals who are African American. Oh, excuse me, as well as those who are older, and those who live in rural communities. just because those are the individuals who tend to be more underserved and really need this information.
Yeah, and another listener said it's essential for survivors to be able to get evidence-based information and resources, but then most importantly, the how-tos for a healthy lifestyle. This reminds me of, we were doing a talk recently um, with survivors of breast cancer, and we were talking about, how do we teach people to be their own advocate in the clinic, in their lives, telling people what they need, when they need it. And one of the women, I thought, so courageously said, I I want to be my best advocate, but I don't know how to be. I don't know how to communicate that. I don't know what the boundaries are. I don't know when it's me being an advocate, and then when it's me almost making the doctor feel like I'm not trusting their decisions. And so many times we do ask patients, be your own advocate, but we don't tell them what that sounds like.
Mm-hmm.
So I think it's the same thing here, that, we want to say, have a healthy weight, eat healthy. What does that
What
mean
does
to
that
different
mean?
people? I
Yeah.
think that's so important too.
And I appreciate this question. And that's something that we really did try to integrate into Amplify. So not only talking in these generalities, but then also providing daily menu plans and grocery lists, and what specific sort of exercise should you do. And so these tools that can help, not only are they general tools, but we have modified them or customized them. So if a person comes in and says, I'm a vegetarian, well, we
Mm.
have a vegetarian meal plan. Or if they want things just really quick recipes, well, because they're working parents or that sort of thing, those resources are worked into Amplify.
Well,
Trying
I
to
love it.
make
Let me share the screen for Amplify, and maybe you can walk us through. Again, like I said, I had the opportunity to go to the website, and I found it to be, I mean, it was so simple, it was so easy to navigate, and I really thought, I mean, this is not just a cancer wellness program, this is a wellness program, but I
Mhm.
understand the importance that it plays in the cancer community. As you said, you tend to gain weight in treatment, you tend to be, more sedentary in treatment. There's a lot of mental health things happening in treatment with the reprioritization of, the daily activities. So this really helps people normalize living a healthy lifestyle in pursuit for health. So if you could just walk us through a
Sure,
little bit
Sarah.
about Amplify, I think it would be very helpful for our audience.
Okay, so this is a National Cancer Institute funded study. It is a study, so we're testing out how to present information. The typical user won't necessarily know, how we're ordering things, but us on the back end, we're seeing how the messages are uptaken, if that's a word, and how they are really playing into a person's health. So everybody gets the same information one way or the other. It's just an ordering type of thing that we're testing. So Amplify is a web-based diet and exercise trial for cancer survivors that are committed to taking the next year. So you've heard about programs like Noom that push out information in digestible packages. Same thing with Amplify. Every week, what we do is we send people prompts, either through their email or their text. Hey, there's another session waiting for you for Amplify. And and then they have these kind of mini classes that you could go to that are roughly around 10 to 12 minutes in length. And then they have like a little assignment, or assignment choice, because we give people choices along the way. And so this is your weekly assignment or your weekly choice. how are you going to integrate this particular lifestyle behavior into your life? And we give you the tools to do that. So it's a year-long program because you can't learn everything about eating healthy and exercising in one session. So by interacting with this program at these little bite-sized sessions throughout the year, we're really seeing some great effects on percent body fat. The people are losing on average around 4 to 5 centimeters off their waist size. They're getting out of their chair earlier or faster. They're moving better. And so we're really excited about the changes that we're seeing. So this is for people who are 50 years and older. And we are recruiting all those types of survivors of breast, colorectal, endometrial, kidney, ovarian, prostate, thyroid, non-Hodgkin lymphoma, and multiple myeloma. So a wide swath of cancers. What do those cancers have in common? These are all what we consider obesity-related cancers. So for them, body weight is really important for preventing progression, maybe preventing another cancer, preventing cardiovascular disease. This is fully virtual. It's free. In fact, every time we do an assessment, and we do 3 assessments on people. We do one before they start the program, one at 6 months, and then one at a year. And we do these over Zoom, so there's no need to come in or anything. And every time we do an assessment, we would provide the person who's assigned, who has agreed to participate in Amplify $50. And that's just in some way compensate the individual for their time and the trouble to interact with us. We really appreciate what they're, them being participants in the program. So that's basically Amplify in a nutshell. And I am happy to take any questions and I really do encourage people to visit our website. If you're going in and talking to your oncologist, please ask them about the program. Your oncologist should be part of your care, and they should know about this. Again, this is fully safe. It's guidelines, evidence-based, and we're seeing great results with this.
Wonderful. So a few clarifying points. This program is for people in survivorship, so they should have completed their primary treatment, correct?
That is correct. Yeah.
Okay, wonderful. And they should not be co-enrolled in any other type of weight loss program. Is that correct as well?
That is correct too. They could be in another like treatment trial or that sort of thing that is more, therapeutically related, but yeah, not in another diet and exercise study.
Okay, perfect. And then we do have a couple of, I'm going to stop my presentation, and we have a few questions from the audience. So one is a comment. People should know this is free to participate for cancer survivors. And like we just heard from Dr. Wendy, not only is it free, but in the planned interventions where they're collecting information, they're actually giving a $50 stipend for your time. So that's amazing. And then we've got a couple of questions. How are you getting the message out about Amplify?
Well, this is a great example. So we want to share it in any way we can, and we really do appreciate Sharon and Sarah helping us promote our message out there. We have roughly 120 more people to recruit for Amplify. Right now, there's over 400. So that's great, but we need to get to a higher sample size, or what we call a higher number of participants in the study, and so that's what we're shooting for. But we have our website out there. We give survivorship talks, so any of you that have support groups that you would want like a more in-depth discussion or presentation. I can't tell you how many 1-hour support groups I have done over the past past 4 years. It's one of the parts of my life, and it's a part of my life I really enjoy.
Wonderful. Well, we have a listener saying, great work,
Oh,
Wendy. We can share this in our newsletter. We will be in touch. It's really an
thank you.
incredible thing. One of the things I think we'll do through Total Health is we are the largest provider of free oncology medical education for the clinic level for physicians, nurses, mid-level providers. So one of the things we'd like to commit to is sending an email blast to all of our clinical learners and letting them know this study is available for patients who are in survivorship coming up for a follow-up visit that may be asking the question, doc, should I stop drinking wine? Doc, how do I get these stubborn 10 pounds off? These are real questions that come up at those 6-month visits. And this is a phenomenal resource for doctors to be able not just to assist their patient, but to add to the body of knowledge in terms of cancer wellness. So I think it's really going to be incredible.
Thank you.
Well, Doctor, I loved having you on this program. We loved going through the Amplify trial with you. We surely will put it in the show notes today, share it out with and tag some of our advocacy partners. Like I said, we're happy to work with you to send an email blast to all of our clinic partners, and keep up the phenomenal work. We know that there's much more to wellness than just, chemotherapy, immunotherapy, radiation, et cetera, in cancer. This really is a comprehensive and holistic way to look at health in general and to live your best life, either during or after a cancer diagnosis. So I thank you so much for the work that you do.
Oh, well, thank you. I really do appreciate it so much.
Wonderful. Take care and have a wonderful week.
Thanks.
Okay.
Bye-bye.